Adam, thanks again for joining us. Appreciate it. We have 42 cases, positive cases of COVID-19 in Arlington. What are you hearing from the Board of Health, the State Board of Public Health, and health officials in general?
So, I think we're hearing a consistent message from both our local Board of Health as well as the state's Department of Public Health that there's concern that there is widespread community spread of the virus, and that testing has certainly been ramping up, right? I mean, it was 2 or 3 weeks ago, there was probably less than 1,000 people being tested in the state, and I think that number is now north of 3,500 or 4,000 people being tested a day. So the state has done pretty significant work in testing more and more people, but we're seeing people all over the community coming down with positives, and as well as people all over the region are coming up positive with this virus. So we're concerned that there's community spread, and the number one thing we can do when there's community spread is to stay home. The less we interact with others, whether they're symptomatic or asymptomatic, the less likely there is to be transmission, and thereby, hopefully we can start to break the lines of transmission.
You're in touch with health officials daily. Do you think we're in the thick of it now? Or, it's so hard to gauge the trajectory of this virus. What we're hearing nationally is that we may be peaking. Other officials are saying we just simply have no idea. What are you hearing?
So, the governor has said that all his data is suggesting that Massachusetts will peak between April 10th and April 20th. So we're just a few days away from that window. And, I do not at all claim to be a public health expert or an epidemiologist, but from all the things I'm reading, it does seem as though it takes 2 to 3 weeks for social distancing to work. And that's why you see a peak even after these restrictive measures have been in place, because the incubation period for the virus is 5 to 14 days. So people could have been interacting as much as 2 weeks ago before the virus starts to demonstrate itself, or symptoms become demonstrated. And given that they're saying now that people who are asymptomatic can transmit the virus, any of us could have been around somebody asymptomatic 5 days ago and still not then show our own symptoms for another 14 days. So it does seem as though all the data is pointing to this peak between April 10th and 20th in Massachusetts. I was on a call on Sunday with a number of other town managers and mayors in the region with Dr. Paul Bittinger, who's the director of disaster medicine for MGH, regional expert, a very well-respected person in terms of dealing with these types of crises. And he suggested that they are seeing some positive trending in the number of people coming in, the number of patients they're seeing both at Mass General and in the Partners Healthcare System. So it's not all the hospitals in the region, but it's a fair amount of hospitals in the region. So they're seeing some positive trending, a curve that's less like the curve in Lombardy in Italy, which was the most severely hit region, and starting to become closer to the Veneto region, which was a more moderately hit region. However, they still do expect by the end of this week to be beyond their normal capacity for intensive care beds and starting to use portions of the hospitals that have never been used for intensive care before. So just like what the governor is saying and what we're hearing in the news in general, it does seem like by the end of this week, we're going to be facing some very challenging times.
Are you hearing about other troubled spots? I know in previous weeks we've been talking, you were telling me about the Minuteman Bikeway, people congregating there. We've been hearing complaints from residents that a lot of folks are not practicing social distancing. Has that seemed to have dissipated along the Bikeway? And are there other troubled spots that you're still concerned about at this time?
Yeah, I think the Bikeway, the parks, there's still areas of concern. After we spoke last week, we did talk about it and decided that closing it was not the right call, that we did want to make sure people had the opportunity to both commute if they needed to get to work on the Bikeway as well as get exercise if possible. But we've been trying to continually issue strong messages about practicing safe social distancing. And frankly, we've received mixed reports. After you interviewed me last week, I had more than a handful of people write to me and say, please don't shut the Bikeway. I'm out there in the morning, I'm out there in the evening. It's not crowded. I'm able to keep my distance. But then I also heard from some people that use it more during the midday, and it seems like it's a little more busy. So we're going to continue to really try to hammer home the message to folks that if you're going to be out there, please keep your distance and stay safe and stay away from folks if at all possible.
How frustrating is it for you to try to get town business done during these times? I know last week the select board voted or approved unanimously a tentative town election date for June the 6th. given what's going to be going on with this coronavirus, you're still obviously in crisis management, full-blown crisis management, correct?
Yeah, I would say that's the case. I can't remember if I shared this with you last week, but I heard some remarks from a leadership speaker down at Harvard who talked about crisis management versus emergency management. And emergency management is usually something that, whether you're in the private sector or public sector, you have a playbook for. You plan for certain emergencies, whereas crisis management means you probably don't have a playbook. That the world has been turned upside down, and you're trying to learn and change and adapt on the fly. And I think it's closer to that in this regard. At least from the operation of government, right? I think our public health officials, I know our public health officials locally train and plan for pandemic situations, but admittedly, all of our process of government, not just Arlington, nationwide, has not been prepared for this upending of life as we know it. Mm-hmm. So I would definitely say it's crisis management. And I would say, certainly there's aspects of it that are frustrating, but I've been blown away by the capability and the willingness of town staff to adapt on the fly, to get up and running at home. I was just reviewing 2 memos from department heads this morning about how they're keeping their departments operational even though they're remote. We're keeping bills getting paid, we're keeping payroll online. The planning department's still trying to run meetings for the Clean Energy Future Committee and the Sustainable Transportation Committee. So we're trying to keep as many trains on the tracks as possible. And I've been nothing but impressed with the team, both volunteers and staff that are, I think we caught our breath for a couple of weeks and not taking a break, but in terms of, normalizing to this new situation. But people want to get work done and people want to move things forward. And I've been really impressed with how willing people are to do it.
You announced last week that you put out a survey to try to gauge community activity as we all weather this crisis, like 6 feet at 6 and so on. What are you hearing back from, what's the feedback you're hearing from residents?
I think, primarily we are getting a lot of interest. Kelly Linema from the planning department, Adam Karowski from IT are leading this effort. And they are getting interest from every precinct, every neighborhood. People want to, everybody's got a different idea of how to contribute or what they want their neighborhood to be doing. But I think, to no surprise, the Arlington community is caring, supportive, and wants to make sure that people stay engaged, involved, even though we're physically separate, but they want to stay socially together.
I think that's great too. And you have people like Campbell Webster, who took it upon himself to go out there and play the bagpipes a few days ago. He's going to be coming back later this week. It seems like it could be a tradition, and that's just a small sampling of what people are doing. You have bears in the windows. You have Christmas lights. You have Arlington restaurants who are doing their part. Their operators of the restaurants doing their part in trying to make things more pleasant during a really trying time. That's got to be very gratifying as town manager of Arlington.
It is gratifying. And it's funny, it is the little things, right? I